So today we are going to discuss about the clinical assessment of tear film. You all know that the tear film assessment is a preliminary examination of contact lens fitting. So in the clinical assessment of tear film, there are two types of tests. By one type of test, we actually measure the quantity of the tear, means the tear volume, and another type of test we actually measure the quality of the tear film, means the how the tear film is stable on the ocular surface or not. So measuring of the tear volume, there are basically three tests. These are the Sharma test, both of Sharma 1 and Sharma 2 test. Number 2 is the phenol red thread test, and number 3 is the measurement of the tear meniscus height. So in today's video we are going to see a practical approach about how to measure the tear meniscus or tear prism height. Okay, so let's move to the practical procedure, and for today's examination she is my patient and I will explain this procedure on her. Okay, I will instruct the patient about his proper positioning of the head. Okay, so you please put your chin here and touch your head with this headrest. Okay, then I will illuminate the slit lamp by rotating the switch, and then after focusing this IPD, I will just focus this to the patient's eye. Okay, so it will bit focus. Now what we need to do, just look at this slit beam. It is now it is a horizontal beam. Okay, so in the slit lamp, if the beam is not horizontal, suppose the beam is like this in the vertical. So first, for measuring the tear prism height, we need to rotate this beam in the horizontal one. Okay, and then this horizontal beam should be aligned with the lower eyelid margin. Okay, so you all can see that this slit beam is now located or now aligned with this lower eyelid margin. So now we just want to measure the height of this tear fluid. Okay, so from this lower eyelid margin, how much this the tear fluid is located. Firstly, we need to align the slit with the height of the tear fluid or tear meniscus. Okay, so now you can measure that it is a little bit aligned. Now from this slit lamp alignment scale, we will directly measure how much it is. It is nearly about 0.2 millimeter. The normal range of this tear meniscus height is around 0.2 millimeter to 1 millimeter approximately. To summarize all these things, I would like to include that there are three layers in the tear film, and mainly the aqueous layer forms the main bulk or the main constituent of the tear film. So by measuring the tear meniscus height, we actually measure the volume of the aqueous layer of the tear.